All right, Miss Emma, you have a seat right there, and the doctor will be right with you. Hey, Miss Emma, is it?
Edna.
All right, Edna. You've noticed on your chart that you have been experiencing a shortness of breath. Yeah. Is that something that is recent, or has it been going on for a while? A while. All right. Do you think it's kind of stayed the same, or do you think it's gotten worse? Any better? Worse. Okay. Let's see. You also noted that your feet were turning blue? Is that right?
Mm-hmm.
Oh, wow. Okay. Blue feet. All right. What's your age? 60. All right. And what are your daily habits? Do you smoke a lot?
Yeah.
Smoke. Okay. Like a pack a day, a couple packs a day, more than 2.
Yeah.
Okay. Well, that's definitely going to be a big part of the cause. Let's see. Do you smoke anything else?
Yes.
What? Do you smoke like marijuana?
Yes.
What?
Yes.
Okay, marijuana. Are you exposed to high amounts of air pollution?
Yeah.
Yeah. It's kind of looking like you might have emphysema. Well, it's a very serious disease, usually brought on by smoking. It is part of the chronic obstructive pulmonary disease. These things called alveoli, and they have they're like air sacs in your lungs. And what happens when you have emphysema is that because of all the pollution in your lungs, over time they start to rupture, and then you have air sacs in your lungs, and just like they get bigger, it makes it harder to breathe. That's part of why you're swelling, because it's harder for the oxygen to get carried through your blood to your feet. And if you have emphysema, I'm not saying that you 100% do, but it's seeming like a very likely cause of why all this is going on. So do you have time today to go run some tests real quick?
Yeah.
All right, so if you could just come with me. All right, so what we just did was take a blood test. It'll take a few days for us to get back to you on the results there. But we also did a spirometer test, plus your forced expiratory volume. And we took that and we measured it in a second. So it's your FEV1. And it really showed us that you have a pretty severe case of emphysema. We can meet in a few days, and we can also work on further treatment and testing for you. All right? For right now, I'm just going to give you some home remedies. So you really need to stop smoking. If you stop smoking and stop the pollution getting into your lungs for long enough, the tissues can start to repair a little bit. It'll make it a little easier. If you can, exercise a little bit. I know it's hard with your feet and being, your age, but you can definitely just try to do what you can. So I'm just going to have you go to the front desk and talk to a nurse real quick, okay?
Thank you.
All right, it's very nice seeing you. All right, I'm sorry if this had to happen. Hello, is this Edna Zima? Hi, this is your doctor, Dr. McNulty, and I just wanted to call to let you know that your blood tests are in and that they did show low levels of oxygen in it. And so between that and your spirometer test, we're going to have to go ahead and say that you have a pretty severe case of emphysema. So from now on, the route we're going to go, we're going to put you on some bronchodilators, which are basically just going to increase the surface area or the diameter of your bronchioles, and they're going to reduce the friction to help you be able to breathe a little bit better. We're also going to put you in pulmonary rehabilitation programs, and what these are going to do is just give you some breathing exercises to kind of help relieve some of the symptoms when you breathe. One of the other options that we have for you is to put you on supplemental oxygen, And this is just going to help relieve some of the symptoms of breathlessness that you said you were experiencing, okay? And then, because you are such a severe case and because of your age and just the significance of it, we might have to consider a lung transplant if a lot of these procedures don't work for you, okay? But that's just if it gets really serious, all right? All right, well, we will definitely keep in touch with you. Let me know if you have any questions, all right? You have a great day.